Hi everyone, this is Bitupan here. Welcome to Mindful Talks. The biggest misconception about Ayurveda is that people think it is an alternative medical system, which means it is the last option to try. What people think is that when everything fails, when the modern medicine fails, that is when you should try Ayurveda as a last resort. Ayurveda does not just mean curing diseases. The word Ayur is a Sanskrit word which means life, and the Veda means science or knowledge. Ayurveda means science of life or knowledge of life. Let me ask you a question. Think about it. The modern medical system has come into existence in the last 100 or 200 years. Especially in the last 10-20 years, it has evolved a lot. But humans have been living on this planet for thousands and thousands of years. So, what were people doing in those earlier days? Were they not falling sick? Were there no cases of emergencies during those days? In this episode, I want to make Ayurveda simple for you. Let me introduce my guest today. I am with Dr. Amit Verma, who is a globally renowned Ayurvedic healer, health and wellness coach, TEDx speaker, and an author. He is the CEO and founder of Vrikshakalpa Ayurveda. With his vast clinical experience of more than 5 years, he has treated more than 50,000 patients suffering from chronic ailments such as arthritis, diabetes, autoimmune disorders, thyroid cancer, and many other diseases. He has mastery in cure and reversal of any kind of arthritis, and his dream is to become India's number one arthritis expert. He wrote his first book, No More Arthritis Pain, Gift a New Life to Your Joints. He's a Bachelor of Ayurvedic Medicine and Surgery, MD in Kaya Sikitsha Ayurvedic Medicine, and MSc in Clinical Nutrition. He's going to debunk some of the biggest myths of Ayurveda and also give some healthy tips to you. I'm excited to talk to him. Let's get started. Dr. Amit, thank you so much for joining. How are you?
I'm doing good. I'm doing good.
All right, I'm so glad to have you on my show. Sir, in this podcast, I want to make Ayurveda very simple for the listeners so that when they listen to this talk, they do not understand complete Ayurveda because obviously it's a very, very huge subject, but they understand some basics about Ayurveda in a simple way. So we'll try to make it simple. Okay, so I want to start with a very basic question, which I think I somewhat know, but I still want to know hear from you, from an expert like you. Sir, is Ayurveda more of a precaution or is it more of a cure?
This question depicts the what is the aim of the Ayurveda being on the earth. Like when question comes, why from where the Ayurveda has been originated and
Hmm.
why the Ayurveda becomes the need of the era or need of the society 5,000 years ago. So when Ayurveda was depicted by our ancestors in the form of the knowledge flow, so they decided the two main aims of Ayurveda.
Okay.
Aim of Ayurveda is swasthasya swasthya rakshanam aturasya vikar prashanam cha. Means very simple. Who are healthy, how to
Hmm.
keep them healthy, and if they are diseased, how to recover their disease from their life. So these are
Hmm.
two aspects of Ayurveda. So Ayurveda is not just merely about the some things you could follow in your life to be healthy. It is also a major line of treatment to cure your disease from your life.
Hmm. So, does it cure all kinds of diseases, sir? Through Ayurveda, is it possible?
In this question, I want to highlight one point. It's not about Ayurveda, allopathy, homeopathy.
Hmm.
It's also about the nature of the disease and the stage of the disease.
Hmm.
Because maybe being a doctor, being a Ayurveda practitioner, I can challenge many of the disease which can't be challenged by other any other medicines. I can
Hmm.
challenge them, but it doesn't mean that okay, I can cure all the disease. So it's
Hmm.
all depend on the stage of the disease and the type of disease. But yes, Ayurveda mainly depicts or mainly concentrate on the cure of the disease, as we do work on the pathology which can be different in all persons. Okay, we doesn't work only on the symptoms, like we have to treat the fever. We don't work on that, okay, we have to bring the temperature down. We work on that factor, why the fever came in that person. So definitely the chances of cure or aspect of curing is more and more prevalent in the Ayurveda, in all of
So,
the diseases.
what I understood is that you go to the why of the disease, not just curing the disease on the surface level, but you go into why and then cure it, right?
Yes, yes.
Hmm. So Ayurveda is basically simple, right? Or is there something that usually people get wrong about Ayurveda?
Oh yes, there are the like, if I will try to share this in very simplest way, because when I started my own practice,
Hmm.
what I did in my life, I worked around 1 year and 1.5 year in the market, and try to know that why people don't want to choose the Ayurveda as a primary line of treatment.
Hmm.
What are the things which are stopping them to come in the Ayurveda for the treatment, or they are not treating Ayurveda for the primary line of treatment. Whether
Hmm.
it is those factors are truth, or they are myths developed by the someone else in their mind. So when
Hmm.
I was working on these factors, the must like first common factor what I saw in the society, the people had a strong belief that like, if your disease is chronic,
Hmm.
or when all options gets end up, then you have to choose the Ayurveda. Second thing,
Hmm. Right.
what I have seen, yes, yes. So what I have seen in the society, second thing is, people had a strong belief that Ayurveda needs a long time to give you relief in your disease.
Hmm. True, actually,
And
yes.
third belief was that, yes, third belief was that, like Ayurveda medicines, there are no standards, or there are no proper guidelines followed for the formation of medicines. And if we go to either practitioner, they will mix some powder and give us, we don't know at all what will be there in the medicines. And maybe they contain heavy metals, or our kidney will fail, our liver will fail, or something will happen to us. So these are the three main things which I had noticed in a society, what's stopping them to come in the Ayurveda to for a treatment. And one more factor which was not so prevalent, but I've seen that people had a belief that either treatment will be so costly.
Ah, got it. I think these first two are very common one. Let me repeat it for the listeners. That first is that people think when all the doors are closed, that is when we have to choose Ayurveda. That's what people think.
You have to choose Ayurveda.
Yes. And secondly, what you said is that what is the second point?
Second point is that people had the belief that the Ayurveda needs a very long time to start giving
Ha.
cure, a relief in their disease, not out cure, relief in their disease.
Hmm. Right. So I have something, just one curious to know. I do not have much knowledge about both subject, but I know somewhat. One is naturopathy and the other one is Ayurveda. So what is the difference or what is the similarity between naturopathy and Ayurveda? Or is one a part of the
So,
other? Hmm. Please.
similarity is that ke Ayurveda and naturopathy both are the sciences which believes to work on the root cause of the disease, and which
Hmm.
believes that ke like using the nature's technology to give relief to patient. But naturopathy is mostly about the using the natural elements like soil, water, something natural elements to give cure to a disease.
Hmm.
But Ayurveda is a combination of like lot of Panchakarma therapies in which you use all the oils and different techniques, and the use of herbs or the
Hmm.
herbo mineral preparations to give the treatment. But naturopathy is merely depend on the using the natural source of the earth, or natural source of the environment to give cure, like doing the mud therapy, water therapy, hot and cold water therapy, heat bath. Lot of therapies are done, like hydrocolonoscopy, hydrocolon therapy.
Okay.
Okay, so using the water for cleansing of the colon. So using the
Hmm.
natural elements which exist in this environment or earth, using those elements is about naturopathy.
Hmm. Got it. All right. So you mentioned about Panchakarma. I'll be interested to know about that also. But before that, I want to know about your Vrikshakalpa Ayurveda, which is you have
Yes,
started.
yes.
Which year did you start? And I want to know
We
about a
started
story.
Vishkalpa.
Hmm.
Okay, Vishkalpa Ayurveda started in 2016. Like
Hmm.
I registered my brand in the 2016. And
Hmm.
as I told you, the first 2 years I had spent on the only and only searching that what people actually need from an Ayurveda practitioner.
Hmm. You did your
So I
research.
did my research. Yes,
Hmm.
I did my research 1.5 year. What exactly people want, and
Hmm.
why people don't want to come to Ayurveda? Like as I told you, people had a strong belief Like Ayurveda needs a long duration of treatment to start giving relief in a symptom. So I made protocol at my clinic, and I taught to my all doctors and my staff कि no one will prescribe the medicine to patient more than 15 days. And we assure the patient within 15 days you will feel the change in your disease. Or I think that was the biggest breakdown of my life, because people had that strong. They had decided in their mind, okay, we have to eat 2-3 months medicines, then only we'll see some relief. But when they start seeing the relief in 15 days, they they
Nice.
like they came to me like anything. They believed me so much, and they gave me so much love. Okay, like in 15 days you are giving us results. And I have during those days they have seen the results within 24 hours also. If someone have severe pain, I gave medicine 24 hours relief. So
Nice.
then people start coming to me, and major role, a very great role played by Panchakarma during this my journey, because Panchakarma is some sort of therapies that I will tell you in detail. Okay, so Panchakarma helps a lot in giving us the very fastest result also. So how this Vrishkalpa started, then 2018 we started our first Panchakarma center in Delhi.
Okay.
And there was a complete Ayurveda consultation, then diet consultation, lifestyle changes, and for them teaching yoga or telling about their diets, and then recommending them Panchakarma therapies, and all this approach under one roof we started in 2018. And journey was like very simple. I was doing work in a very reputed company, and I used to see a lot of patients. Everything was very going clear. But thing is, again, that I told you, I had a one very big question in mind. People doesn't come to Ayurveda. They want to come, but they can't come to Ayurveda because they feel that doing Panchakarma therapies or taking Ayurveda medicine is a costly process for them. So I start working on that. That was the only one thing which made me to start my own venture, because only belief I had that I have to make available this Ayurveda and Panchakarma to that 80% or 70% population who want to come to for Panchakarma, who want to do Ayurveda treatment, but due to cost maybe they are not able to afford it. So our vision was that, for according to that we started this our venture in 2018, and now we're looking forward. The other part of this starting venture is like, I have seen that like in my class only, like in my friend circle, out so many people did the Ayurveda graduation, but they failed to set their career, or they're feeling so much difficulty in setting their career, or
Okay.
maybe they are not getting enough practical knowledge how to do the conventional practice in the Ayurveda. So the other aim is to me to start doing work with them and spreading Vrishkalpa Ayurveda, and setting a very entitled career for them for their lifetime, and spreading Vrishkalpa Ayurveda all over India with them.
Nice, very nice. So let's talk about Panchakarma now. Okay, it means some 5 different karmas are there, right? I do not have much
Yes.
idea about it, but I would like to hear from you.
Panchakarma, basically Panchakarma is like Panchkarma, Panch Karma. So Panchakarma are 5 basic main procedures which are used for being detoxification of your body. Like what we believe that in your body a disease starts with the minor collections of the factors, and with time being these factors start getting collected in the body as in the form of the dosha, means the culprits. So these doshas start accumulating in your body, or when they exceed their limit, means they cross all the barriers and they become in the maximum amount of your body. The best technique is to remove them rather than suppressing them or treating them. Remove them from the body.
Okay.
Like I take a small example. If there is a small pit around your home, or if water is collecting in that, maybe we'll put some sand in that, and the pit will be over. But if there is a big pond of water, if you're going to put sand daily in it, nothing is going to happen. In that case, you have to remove the water, and then you have to fill with the sand. Then only that pond can be vanished. So I
Right.
will believe in the same concept. Again, one factor, if you want, like if you cut a tree from the ground level, it will grow again. So if you want to remove a disease from body, you have to cut down from the root. So these are the two
Right.
basic concept which relies behind the Panchakarma theory. So Panchakarma, 5 main procedures which are meant to clean your body from the root. Like, and the 5 karma is designed according to the disease where it is in your body. Like if the disease in the upper part, we can do nasyam therapy
Okay.
from the nose. If disease in the upper part, we can do vomnam therapy, like vomiting therapy. If
Okay.
disease in the lower part, we can do purgation therapy, that is virechana therapy. So like
Okay.
if disease in blood, we can do rakta mokshan therapy. If disease due to vayu and the colon, we can do basti chikitsa. Like these are
Okay.
general outline I'm giving. So why these five karmas are selected? There are a lot of the factors why only the five karmas. Like according to dosha, like vata will increase, pitta increase, kapha is increase. Which entity is increased, which therapy should be selected for them, where actually the disease in the body, so according to that which therapy should be selected. So there are different parameters. According to five karmas are decided. Then
Hmm.
under these karmas, as a puru karma and so many things, there are hundreds of therapies according to different disease. Hundred of therapies we are doing in panchkarma.
Right.
Like
Got
for
it.
if someone has advised to change the knee for knee replacement, for them we are doing janu basti is a very very good treatment. And even we had stopped so many surgeries just with the janu basti treatment.
All
So if someone
right.
have back pain, kati basti, if cervical pain, griva basti. So there are a lot of treatments in the panchkarma. But
Hmm.
why five karmas? Because this panchkarma is mainly for the detoxification of the body.
All the five karmas are for detoxification, but depending on what
Yes.
kind of issues the person has, you give either one or two of the karmas. Am I
Yes,
correct?
one or two karmas, three karmas, combination of the karmas, according
Okay.
to the disease, person, age, climate, where he's staying, what kind of habitat he have, what type of
Hmm.
nature of work he have, everything will be considered when planning panchkarma.
Nice. And I also saw somewhere that Panchkarma also helps in detoxification of the mind. So has it also something to
Yes,
do with the mind? How does
yes.
that work actually? Hmm.
Ayurveda has a very very broad description of the all the psychological disorders. Maybe you
Hmm.
are like in Ayurveda we call as unmad, apasmar, atatva abhinivesh, like OCD, epilepsy, schizophrenia. So we
Ah,
have the treatments of all the disease mentioned in Ayurveda, and accordingly we select different panchkarma. Like
hmm.
most common practice which people know very very much in the society about the Shirodhara. So they
Okay.
say that Shirodhara is a very very amazing treatment for the any kind of mental illness.
Hmm.
Even you are not ill by mind, but still you want to keep your mind relaxed and you want to keep your mind healthy, rejuvenating. So you can go for the Shirodhara. Again,
Hmm.
Shirodhara have different variants with the oil, with buttermilk, with herbal decoctions, milk. There are so many options. Then again, it will be selected according to disease and nature of the disease and person.
All right. So you mentioned about OCD. Okay. And I do not want to extend much on this topic, but let me tell you, sir, when I was a child at around age 10 or 12, I had OCD. For almost 4 years, I was suffering from OCD. And for those of you who do not know what is OCD, it is called obsessive compulsive disorder. Okay, it is not a very major mental illness as far as I know, but you just keep on doing something. My OCD was that I wanted everything organized on my table in a symmetric way. If there are some let's say pieces of cards kept, I do not want to see them scattered everywhere. I want them to be symmetric. And when I used to walk on the floor, okay, if there are tiles on the floor, let's say there are tiles on the ground, I will put my leg exactly at the center of each tile and then walk. So that was very strong OCD of mine, but somehow it went off.
Yes.
Why does
So
OCD
in
happen?
Ayurveda we
Huh?
call as a tattva abhinivesh. Very
that's
very
that's the
clear.
name of
See,
OCD in
OCD
either. Okay.
a tattva abhinivesh.
Okay.
So a tattva abhinivesh is what? A tattva means which doesn't exist.
Okay.
Abhinivesh is we are trying to find it.
All right. Oh,
So
okay.
it is nothing after the English, our urge or our strong sensations to find such things which maybe is not existing there, which we are
Hmm.
not present there, but we are trying to find that thing there. For
Hmm.
example, there is some rope is there, and we are trying to understand. No, that is not rope. That is a snake.
Oh, okay. Huh.
Okay, like as you told again, repeated habit of checking, like you're going out of home, the home you are checking again whether
Checking
you
the
have
door
locked the
lock.
door or not.
Hmm.
Yes, so we are trying to repeat the things to find out. No, no, that was true. What I'm thinking. Gate is open.
Hmm. Okay, it's like a
So
satisfaction
we
to
are
the
trying to
mind.
find out. Yes, we are giving
Hmm.
the answer to our own mind, our own depict thoughts. Can no, that is not what we are seeing. Is not right. What my mind is saying, that is right.
And as a child, I did not know that I had this OCD because that was like long back, and I did not. There was no internet at that time. But when I grew up, I was around 22 years old, and then internet was very accessible at time, and uh, I heard one of my friends saying about OCD. Okay, then he was explaining to other friend. I overheard him, and that is when I realized. I started searching more about OCD. I got a lot of videos and a lot of articles. That is when I realized that, oh, I had the same issue when I was a child, and I did not even know about it.
Yes, that usually happens when someone
Hmm.
says to us about OCD. Then we try to start relating our own symptoms. Like that, usually are not symptoms; that are our own habits. And then
Hmm.
we start relating our habits. Like someone have the like. I am telling about myself. I had some curiosities like when you're doing washing hands. I used to. Want to wash the hands from back also from here, but
Hmm.
that was a maybe normal process for me. Okay, but when someone says me, yeah, what you are doing, this looks like OCD, and that was that one single thought. When I start searching for the OCD and then start believing that no, I have OCD only. That
Hmm.
mismatching of thoughts take us to the OCD of only. And usually what I have seen in my practice, that is the story of the most of all the person of who are suffering from OCD. They may be having similar type of practices which maybe OCD patient can have, but when someone tells them, "Okay, like you are behaving like a OCD patient," and that is a turning point for them.
Right. And how common is OCD, sir? Is it one in 100 or one in 1,000? Just an approximate
Sir,
idea.
that I see according to studies, but I think what I am seeing my practice nowadays, I see OCD patient very oftenly. I am
Hmm.
seeing in many of the age groups, and but very oftenly in the age group of 20 to 35 years of age. I'm
Hmm.
seeing OCD very much.
Right. I think probably we can talk about separately about OCD in a different talk
Yes,
show.
yes, yes,
Here,
yes,
I
yes.
just wanted to talk
Sure.
about Ayurveda and arthritis. You are specialist in arthritis, and I want to know about
Yes.
arthritis, sir. What is the reason for that? Why does arthritis happen?
Arthritis, people have to understand one thing. Arthritis is just starts from a simple pain, simple stiffness, simple swelling, simple decreased range of motion, simple discomfort in your in your any other joint or in your body. That can be any variant of arthritis. So why I always start my talk with this, people always neglect such things.
Hmm.
They wait for such day. When the day will come, they are unable to sit and stand. They will be unable to walk, and the pain will be so much that they could not sleep. Then they start believing that maybe they will be having arthritis. So
Right.
arthritis have many other types. There are like seven major type of arthritis. In that, there are about 137 type of arthritis exist in this world.
Oh.
And the most dangerous thing what we do in arthritis is that we believe that treatment for each arthritis is same,
Oh.
but
Got
it's
it.
not.
Hmm.
That's why I selected this arthritis as my dream, to recover million of people from suffering from arthritis. Because once the people start got tagged as arthritis, they believe that they don't have any cure. So arthritis of many of types. The most common arthritis what we see in India is around like osteoarthritis, which is usually seen in the bigger joints or the weight bearing joints like knee joints, ankle joints, hip joint, mostly in these parts. There are one more variant, rheumatoid arthritis, which is basically the autoimmune type of arthritis,
Okay.
where the our own immune system deploying start deploying our own system of locomotor systems, joints, bones, connective tissues. So this is rheumatoid type of arthritis, in which our immune system get attacking on our own structures. And third is most common find is gouty arthritis, which is a metabolic type of arthritis. Where when I say about metabolic, so there are some metabolic issues due to that uric acid is secreting in our body or is not able to excrete from our body, and it start depositing in our smaller joints first. Then
Okay.
later can be bigger joints can be affected. So this is
Hmm.
gouty arthritis. There are some few type of arthritis which is very becoming very common nowadays, like fibromyalgia, then ankylosing spondylitis, lumbar spondylitis, cervical spondylitis. Very common nowadays due to our work pressure, working style, working long hours on laptop, no correct postures. We sleep like a U shape in the on the sofa. So there are so many
Um,
factors which are causing so many types of arthritis. Then multiple sclerosis. These all comes in the type of arthritis only.
Am I sitting correctly right now? I think the ideal way to sit is
Yes.
like this, is it?
Yes, ideal way we have to sit like this only. So
Hmm.
if this is the for our comfort. So if some person what tries to they lie down, this is for our lie down. Okay, but the thing
Hmm.
is you should keep your back contact with the back posture. Then you
Uh,
can lie down like this. So this lower joint will move. But what we'll do is sit in the front of the chair. Then we'll lie down back, and we make our back
uh,
in the U shape.
okay, got it. And one thing that I want to know is that I hear a lot of people having back pain. Okay, and I want to know, does that really work? See, when we have back pain, what people do is people give massage, and people start using some ointments like Move and all. Some ointments are there, creams and all. So what I understand is that back pain is something from inside of the body, but when we do some massage, it will give some relaxation for time being. But does that really cure the back pain? Is it possible to cure the back pain just through massage?
No, the thing is that back pain can be due to different pathologies. Okay,
Okay.
like for example, definitely applying some ointment or doing some massage give us relief for some time. But definitely we have to work on the pathology of
Mm.
that particular back pain, whether it is a disc bulge, canal stenosis, slip
Mm.
disc, disc degenerative changes, compression of disc, lot of factors
All right.
in the pathology. So we have to definitely work on the pathology of that particular lumbar spondylitis back pain case. What is the pathology behind, what is the cause behind that particular person. Definitely
Got
doing
it.
massage or applying some ointment give you relief,
Relief.
but
Yeah.
it doesn't cure your disease until unless you
Mm.
don't work in the pathology inside. Like doing massage may doesn't give relief, but as we do, I told you, we do one treatment kati basti is a complete typical procedure to treat the disease, not just for relaxation of back pain. These
Mm.
kind of therapies have the immense power to cure the back pain.
Mm.
Those therapies work on the pathology of the disease, like they strengthen the ligament, they reduce the inflammation, they may provide the strength to all the structures, bones, they stop the osteoporosis of the bones. So these are what we, these is therapies where we work on the pathology of the disease, not just on the symptoms.
Mm. Got it. All right. And I think I wanted to ask you the last question, which was about your book. You are an author. But before that, just for my curiosity, I just want to ask you one more question, which is that now, when it comes to broken bones or any kind of emergency, we have medical facility where immediately you go to hospital and you get treated. But what people used to do before this modern healthcare came, what people used to do for any injuries or for broken bones?
Uh, Very good question you had asked.
Hmm.
Like maybe you have heard the topic in nowadays, the government had allowed 56 surgeries to the Ayush doctors.
No, I haven't heard about it. No.
Yes, government had declared the new passed the new bill. In these 56 surgeries are allowed to Ayurveda practitioners, especially
Okay.
who have done their MS in the Ayurveda.
Okay.
Okay, so like I did MD in Ayurveda, so there is a
Hmm.
MS also in Ayurveda, and
Hmm.
those 50 surgery, there are all the bone surgeries are included. So there was a
Hmm.
time when there are father of surgery who is known as Shushruta, who
Okay.
was there as a father of surgery. Like if you go to the renowned Ayurveda, allopathy hospital also, in their books also which will be written also father of surgery was Shushruta. So
Hmm.
Sushruta conducted all the surgeries and he mentioned all the procedures of the surgeries. So even
Okay.
though I was not there in the old eras, but from the literature, what has been found and how we are proceeding forward, there were the methods already discussed for the surgeries in the bones and injuries and management of emergencies, and that used to be
Oh.
managed in the previous era also.
Hmm. That's nice.
Like I have seen that Sushruta Samhita mentioned about the complete procedure of the fascioplasty,
Oh,
and you will be shocked if you read the procedure of 2 days. The same procedure was written 5,000 years ago. How to do
wow.
the fascioplasty, nasoplasty, and cleft lip, cleft palate, how to do surgery of that. The same process is followed till now.
Wow. That's really nice actually. We have so many things to learn from our ancient wisdom. Nice.
Yes.
Okay, sir. Last question. Tell me about your book.
Oh, my book is No More Arthritis Pain. Gift a new life to your joints. And the
Hmm.
journey is very fruitful. How I came to understand how why I should write this book. Like being an athlete, I was in sports. I used to play sports very much, and I have seen my own grandmother one day, and she was sitting with a bunch of medicine in her hand, and I
Hmm.
just stopped myself at a moment and asked her, what you are doing this. And just she told me one thing कि बेटा अगर आज मैं ये मेडिसिन खा लूंगी तो मेरा आज का दिन गुजर जाएगा.
Oh.
That one line stuck somewhere in my mind. Like if my own family, there are so many persons who believes us that believe. I can't say I say believe, but they think that they don't have any other options. So I took as a pledge in my life that I have to work on the arthritis. So this is my first step to aware people. Just I did not mention any such treatments in that. I just want to give that positive vibe to a person. I want to educate them. I want to like push them. Okay, like don't believe that arthritis is not curable and your life is stuck and your life is hell now. Your
Hmm.
arthritis is completely curable and reversible. Only and only thing need for that is the commitment of yourself. How much
Hmm.
you do you respect your body. If you do respect your body, no one can stop to cure and reverse your arthritis.
The body will
So
also
that was my
respect
first.
you.
Yes, that was my
Hmm.
first step to initiate my pledge. So like people usually get the articles say that this treatment will do this treatment will do this, but no one wants to aware the people to remove their fear from their mind. And nothing will happen. Arthritis is a disease like any other disease. Just your efforts, the one beginning can change your life,
Hmm.
and one neglection can make your life like a hell. So I always say, even though I have written in my book, okay, never neglect joint pain just as a pain, because you never knew the next day can be the worst day of your life.
That itself is a signal that something is wrong. That pain
Yes,
itself is a signal.
yes, yes.
Hmm.
So that only thing you have to consider, and consult your doctor in the first earliest symptoms. When you get it, it will be easily curable. If you do wait for 3 years 4 years to come as a complete power like a demon, it will give you pain.
Nice. Okay, sir. Then it was great talking to you. I think the biggest learning people should take, and I also should, I have taken, is that Ayurveda should not be the last option. In fact, it should be the
Yes,
first option. And secondly, Ayurveda does not take,
yes,
it's not a long process. It's, I
not long
actually,
process.
yeah, I was shocked to know that there are, Ayurveda was used for emergency also, as you mentioned right now. 5,000 years back, it was written there.
Yes,
That's a good learning. Nice,
there are
very
such
nice.
formulations, procedures which are you meant specially designed and defined for the management of emergency.
Wow, that's
I do
nice.
treat paralysis patient without admitting to hospitals.
Hmm. In fact, our podcast also got delayed by some time because you had emergency cases today, right?
Yes, we I
Yeah.
had two emergency cases, so I delayed it. So it
Right.
happens.
Right. Okay. Fine then, sir. Thank you so much for joining. It was really nice talking to you
Okay.
then. All right. Thank you, sir. Bye bye.
Thank you so much. Thank you. Bye bye.